As a primary care track resident, we do get a block session. So as a first year, we get 2 months, and as a second and third year, 3 months. And during the block, we actually get to work with 4 or 5 different subspecialists in their clinics.
There's a lot of flexibility within the primary care track program. So about a year in advance of your upcoming schedule, Dr. Addington White will sit down with you, go through your schedule, and ask you if there's certain areas. So she sort of has a large pick list of clinics that you can choose from. So some of your interests might already be there, but if there's an interest outside of what her sort of pick list involves, then you can go ahead and ask her. She can help set you up with a mentor if there's someone you'd be interested in working with.
I think by being in the primary care track, by no means are you boxed into primary care, and if anything, I think being in the track gives you greater exposure to subspecialists than you would otherwise. I've gotten to work in the clinics of rheumatologists, cardiologists, endocrinologists, pulmonologists, and dozens more. And so I think I've gotten to explore all of the other interests that I've had. And while some of them have sort of tugged me in certain directions, I've always come back to primary care because I'm one of those people that sort of enjoys a little bit of everything. So I think by being in the primary care track, I've actually gotten more exposure to subspecialists than I would have otherwise.
Right now I have a resident who's very interested in taking care of pregnant women. So she'll be doing a rotation in the congenital heart disease clinic during her block and in the high-risk OB clinic.
I think those clinic blocks are great for looking into subspecialties. And then if you find something you're interested in, kind of letting Dr. Addington White know to get into other sort of actual whole month blocks or rotations in the future.
Other resident now who's interested in working with the homeless population. She's working in a prison clinic and she's working in one of our outreach clinics. So very strong subspecialists who are committed to the idea of training general internists. Because you don't want to be in a situation where you're just getting subspecialty training without any thought about what your career path is. And again, these are all hand-picked doctors that I know well, I practice with, and they're wonderful teachers.